both through online as well as offline channels for this healthcare community. So we are all very excited, and I think it's a start of a great journey. I was at the FICCI event for healthcare last week, and I must say that this time actually there was participation from 23 countries in the FICCI event. And then I attended the patient safety conference that Apollo had conducted on Saturday and Sunday. And again I found significant participation from Europe, Japan, or many countries in Asia and Africa. And it seems to be, as I see over the last few years, there's been more and more interest than before in Indian healthcare and Indian healthcare businesses. It's a great time, and our objective is to put whatever we can with respect to Indian healthcare businesses on the global map. And we look forward to whatever we can do with you, Sarah, in this endeavor of ours. And a great session for each one of us. We have a small group here, and at some point, maybe after we complete the session, we will take advantage of a very quick round of introductions from everyone, if you do have time, so that we know who all are here. I do know that there's a great mix of both healthcare entrepreneurs, advisors, investors, and social organizations in this room. I think it's great. Thank you, and Sarah, welcome to you.
So I wanted to take a few minutes to give you a background about our organization and what it is that we do, and then share with you a little bit about some of the recent research we've done or trends we've recently seen among the entrepreneurs in our program, and then some work we've done looking at impact investors and how their organization can help. I'm sure that many of you have more to contribute to this conversation than I have to offer, so I really hope that you'll interrupt and ask questions and give feedback. I wanted to start by saying I think our efforts, I hope, are very complementary to the amazing work that Ty and others in this field are already doing here in India. And our organization is really a global network. We were founded a few years ago with support from McKinsey, the World Economic Forum, and with the idea being that there were all these really interesting and innovative ideas taking hold with small scale in different parts of the world. And it would be really valuable for those bright entrepreneurs doing things at small scale but with high potential to learn from one another, to benefit from the convening platform of a group like the World Economic Forum with consulting expertise of a group like McKinsey, and the academic center that is Duke University's Duke Medical System to support and strengthen their efforts. And so that's what Anne and myself and my colleague Logan here try to do. We act a lot like a broker, not providing financial support, but bringing together and connecting peers and bringing them together with experts and others. I would say our work falls into three clusters. The innovators are the root of it all. We work with about 43 companies scattered across India, East Africa, and Latin America. And every year we identify the next cohort, and then we provide extensive support and connection to them, like I just described. We generate insights, so we are, like many nonprofits do, we put together white papers and case studies and other reports that describe some of the trends and themes across the regions we work with, and then we try to frame and support collaboration. So this event, but others that we host regionally and in the U.S. are a big part of what we're doing to get people talking across verticals, whether it's right now. Where our support and how we are funded ourselves through the financial contributions of several corporates and foundations. These are all organizations that are really interested in learning from the models of the entrepreneurs in our programs, and most are actively working in health and life sciences. One additional sort of set of caveats I want to give about the entrepreneurs we work with is that they tend to be past so they have, they have 2 clinics and they're looking to go to 50, or they have an initial set of users and their devices and they're looking to roll out across the markets. So they're proven. They are generally a mix of nonprofits and for-profits, but they all want to operate under a sustainable business model. They are doing something innovative, and I know that's a hard word to define, but for us it means that they are able to demonstrate that what they're doing either addresses issues of access, cost, or quality in a way that's significantly improved relative to what exists in the market currently. They are ready and interested in scaling, and they want to collaborate. We are actively looking for entrepreneurs to participate in our next cohort, which are interested in folks that meet this criteria. And if you know of anybody or are somebody who meets the criteria, please chat with us at some point while we're here. We're also here today with the support of USAID and Maggie, is with us from USAID. And one of the things that our organization at GAG implement is an accelerator program that's hosted in Duke. And the idea as part of USAID was that there's a lot of energy and potential within academic centers to support entrepreneurs. And wouldn't it be great if an accelerator program tapped into the energy of faculty, students, and the research mindset to both better support these companies and then study what works in terms of supporting them. So we are using our network from IPIG and our team to lead the process of stewarding the innovator or the entrepreneur experience of these accelerators, and in part are being studied and evaluated by a third party. And so some of our researchers at Duke are trying to understand what works from our suite of services. And so at the end of this, we'll also be able to talk about what we found to be the most effective, valuable support services on the part of the commercial, so really how we function. The SEED program is a 3-year program, so entrepreneurs that are going through their journey to scale really do need more than a 6-month intervention. We work with them over a longer period of time to dig in and try to really address and help them understand and think through some of their bigger challenges. This is our sort of high-level set suite of curriculum areas. So these different buckets are things that we provide support around and have built either tools, resources, or in-person workshops or learning sessions with small groups of entrepreneurs to address. This is probably illegible for you from where you are, but let me just say that for 2 organizations in a program that are based in East Africa, we've done everything from help them connect to investors and work through their funding pitch, to improve their internal systems to collect data, to connect them with marketing experts at the business school to build and design a testing plan for a new product, to connect them with board numbers, to help them design and implement quality metrics. So there's a range of stuff that we're able to do with our network that we're really finding to be quite effective and necessary to get these entrepreneurs more quickly through their scaling struggles. Okay, I'm going to stop and ask if there are questions about what IPIG is or what SEED is, and then I'll say a little about something else. Yeah?
So as opposed to IPIG is SEED for early stage entrepreneurs?
Actually, no. Both organizations are for growth stage, the scaling stage.
Okay.
SEED is just a bit of a more intensive engagement for the IPIG. Yeah. So again, we don't provide any financial support at the moment. We're strictly providing non-financial support. I would say it's hard to describe in a few stats what the organizations look like. Many of them have fewer than 10 employees. Many of them have revenues under $2 million and are probably 3 or 4 years in business. But that's there's a good distribution. Yeah.
You mentioned that you support not-for-profit organizations as well.
Yeah.
So what does an investor look for in that?
Yeah, again, that piece that we do around access to funding and investment looks different if you're a nonprofit or you're a for-profit. If you're, and then actually it sometimes blurs both. Like we may help a for-profit look for grant funding and for-profit funding. On the grant side, we do everything from helping through how to craft proposals, how to identify target funders, how to structure and present the pieces of to take on a loan, we help them think through some of those choices and think about which kinds of investors would be the best partner for them. And then we often are able to facilitate introductions and support those connections. I should also add that one of our partners is an angel network of investors in the U.S. And so we've been able to get many of the companies we work with are still looking for very early stage funding. And so even though they may have benefited from they themselves may not be exactly an early stage organization, that sort of very early stage company has even within it different phases. So we can connect them to those.
Just to add, does it mean that on the funding side, there are some organizations who are looking for philanthropic kind of funding?
Yes.
Sir, are you looking at starting something in India as well?
Yeah, it's a great question. So again, historically we've tried to do all of this from North Carolina and spent a lot of time on the road. We realized that there's only so much we can do from afar. And so with support from USAID, we've actually recently gotten approval to launch a program in East Africa. And so we'll be putting a resource on the ground. We'll have money to subcontract to partners to provide support that we don't have the expertise to provide, and also tap into faculty and researchers at universities in East Africa. That model of building a regional node to complement what we created from the U.S. is something that we love to do in India. I don't get how it works. But are exploring.
What time this program begins, sir?
What time?
The program begins. Is there any deadline, application deadline?
Yeah, so we've been accepting nominations all summer. We've had 115 folks apply so far. It's a bit of a rolling basis, but we're pretty close to stopping that process. We'll invite of that 115, 20 to 30 to apply, and then we'll pick, and then the full application is due mid-October, and then we'll make decisions in December, and then the 10 or so we select will start our program in January.
And then does the next one start after that?
A year after.
The
So in the next, we only do it once a year. So the
Oh,
next
once a
cohort
year.
starts-
Next summer.
Exactly.
I had a question regarding technology. Do
Yeah.
you guys maintain a database or some kind of a structured way where if a technology investor is looking for problems to resolve in the healthcare sector, is there a structured way to do that?
Yeah, our name is, it's maybe not obvious from our name, but we work with companies in delivery, technology, and financing or insurance. And we have a database of the 40-some odd companies we work with, and we also keep data on all the people that apply. We don't have a systematic way of sharing that, but I think on a case-by-case basis, if somebody who's interested in learning more about some of the companies we can think about working with, we can connect.
My question was more from a standpoint of startups. If they have a problem which is roadblocking their scale of technology problem, is there a system to reach out to some other technology?
No, it's a good question, and we can maybe take this offline too. I mean, in general, I can speak for Catherine Logan. Our team is really happy to support people that aren't in our program directly as well. So if you have a question and we have a resource or an obvious connection, I think we're
Sure.
happy to provide it.
I can take it off.
Yeah.
Does the program work on online strategy, or can somebody be in India and be a partner?
Yeah, no, I mean, almost everybody in the program is not in the U.S. They're in India, and East Africa, Latin America, they're all over.
Is there a requirement to leave the US for
So for the seed curriculum, we pay for the entrepreneur and sometimes somebody from their team to come to the U.S. once a year for an intensive summit. Additionally, for the folks in the broader network, we pay for them to come to a big exchange where we get investors and corporates and others. So the hope is that there's value in the companies coming once a year to the U.S. To meet with others that might not be in their immediate community. And there's a lot of learning that happens between entrepreneurs in Latin America, in India, and so we hope to create these sort of global peer communities too. So, any other questions? And these are great questions. Thanks for asking.
That your focus is on primary care,
Yeah.
with lots of services, where the technology development,
Yeah.
also integrity.
Yeah, so I think that let me just step back and say when the organization started a few years ago, the emphasis was really on delivery. And so this snapshot snapshot, which gives a view of the subset of the companies that we work with that are in India, which is about 16. Of those companies, the vast majority are in delivery. We aren't committed to having the focus always be so biased towards delivery going forward. It's more of a legacy where we come from. Within delivery, as you can see, the mix of primary and specialty care as it breaks out is really, I think, an artifact of who we saw. There was some of the different innovative models we saw, and the fact that there's a lot of innovation happening in specialty care, and the different kinds of innovation happening in primary care, which I'll talk more about in a minute. And maybe that's a nice segue to the next slide, just to say that this is by no means definitive. It would be great to get reactions to this, but we looked across the companies that we work with in India and tried to understand whether there were any patterns in whether they were structured as a for-profit or non-profit, and within the group that's working in delivery, whether they were focused in primary care or specialty care. And so this is a framework that we're thinking about trying to test in other regions as a way to understand which kinds of service models for delivery only work best in which settings. And we noted that in our group of models, that the for-profit folks, so I'm looking at that far quadrant there, that are doing primary care are able to make their models work in a for-profit way because they're in high-density settings, working with urban populations. They are addressing not just one disease area, but many of the most prevalent disease areas, and their location and strategy very much is a hub and spoke approach. SWAS is here today, and they can talk about, I think, how their model fits exactly into this bucket, and then we have another group called Pathfinder India that has a similar approach. On the flip side, the nonprofit models that we see working in primary care tend to be not in urban areas, but in rural areas. They tend to be working and serving under-addressed or hard, high-impact services like Operation Asha, which addresses TB. And they tend to rely heavily on community outreach and community health workers to tap into those hard-to-reach populations. If we take the other column, one of the trends we see is that folks who are offering a for-profit model and working in specialty care do so by creating these centers of excellence for specific needs. And so we have Narayana Health and Life Science Hospitals in our network, and both of them take either maternity or cardiac care as their specific focus area, and they're able to make margins and operate as a for-profit venture because they get really good at that, and that specialization or factory focus allows them to operate at high volume with lower margins. On the flip side, we see that folks providing specialty care to hard-to-reach populations in underserved areas tend to need to operate as nonprofits. And so Vision Spring or the LB Prasad Institute, both addressing eye care, but doing so using community workers and under a nonprofit structure. So this is by no means a forced boxing of organizations into clusters, but rather a way to think about, to take what we've seen and try to generalize about which aspects of different models work well with which settings and disease areas. Any questions or comments on this? Well, if anyone wants to talk more afterwards, I'd be happy to share. The last thing I want to talk about, and this is where I really love questions, is that through the work we're doing with our entrepreneurs and with the SEED program, we've been doing some research to try to understand what impact investors are looking for when they think and see and evaluate companies like the ones in our program. And so our goal in doing this research was to basically better understand which kinds of organizations might want to fund the entrepreneurs in our program. We did this work with Caliber Foundation, which is a U.S. lending organization that has a global portfolio, and they were interested in doing this research with us because they wanted to increase the portfolio that they have that's in global health. So this is research about impact investors that we conducted earlier this spring and are going to publish later this fall. We talked to, we tried to landscape the investors who fit the criteria that they had parts of their portfolio in East Africa or India that they were offering debt and equity, typically between $200,000 and $5 million. they were either health-focused exclusively, so they were a health-focused fund, or they had a significant portion of their portfolio in healthcare, and they had an impact orientation, so they were either self-identifying as impact investors or had some otherwise representation of impact focus. So we talked to about 25 different organizations over the past few months and asked them a range of questions about the nature of the deals they've made, their experiences working in healthcare, the sort of attitude they have about where the market's going and the challenges they face. And these are just some of who they are. They really span from development finance institutions to family offices to small and large health funds. So, please ask questions, but the gist of what we found fall into 4 buckets, and I'll describe each of them in the next few slides. Basically, probably obvious, and as I heard the energy around Ty's recent work in this space, there's growing emphasis and interest in healthcare as an investable sector. People say there are a confluence of reasons ranging from a growing middle class who's able to spend money on healthcare to the proliferation of technology that can help make delivering care more affordable and effective. And interestingly, we see more and more multinational corporations investing in this space. And then this section is a way that, it's a first pass framework for thinking about where the role of impact investors might be when it comes to investing in global health. So the column or the rows rather represent a sort of schematic of the customer segments that an investor or a sort of business may be trying to serve, and the top columns represent the funding sources that might be best suited to meet their needs. And so it sort of depends. I mean, this is a very flattened approach to describe, and we can send around parts of these slides later. I feel bad that they're all right here next. But the idea is that a lot of the rural and very urban BOP is hard to serve with models that are for-profit, or if they are for-profit, they're largely going to rely on grants and other sources of funding to make their businesses work. On the other hand, some parts of the urban BOP segment and the urban suburban middle class, which is defined quite differently depending on if you're in Kenya or India, which was some of the 2 primary countries that we looked at, really do present opportunities for impact investors to play a greater role, and that in fact there is a need for more investors at the early stage and along the journey to play in this space to help spur and nurture health entrepreneurs in this serving these consumer segments. On the flip side, the urban, suburban, and high-income consumer segments tend to be supported by debt and equity, but market players are able to come in and invest there. It may not be as necessary for impact investors to step in. I know that this framework is somewhat crude, and there's a lot of additional dimensions to this, including which piece of the healthcare value chain you're operating in and which stage of life your company is in. But this was a framework that we sort of heard resonate, come together for our discussion with folks. This is probably stating the obvious to many of you in the room who live this every day, but many of the investors we spoke with said that there's a real need for better communication across players in the ecosystem. And a lot of the private sector investments felt in particular like it was really hard for them to know, and sometimes gave them the jitters to not know what the public sector was doing and how they were thinking about policy changes or other approaches that may impact the viability of the businesses that they were trying to support. Additionally, the same was said about donors, that it's hard to sometimes understand how their money sits alongside donor money and who plays where is not always obvious. And that leads me to the last finding, which is that over and over again, investors said that they saw the real gap in the medical professional community and the sort of trained professionals who could support the medical community. There was a greater need for R&D funding, so that especially in health where the R&D stage is so long and resource intensive, and that health education and awareness, basically doing the public health outreach for the community is another area where both philanthropy and government could take a stronger position to free up the private sector to fill more of the needs in the delivery systems, global and commodity space. And so one of our recommendations and hopes is that in addition to sharing some of this work with investors who we hope will use this as a call to action to put more money into the space, so we can also engage the government and philanthropic communities to build up around the science. So again, I'll just recap and then I'd love to get questions. What we're doing here is the synthesis of a bunch of investor conversations, and our rationale for doing it was to try to better figure out how we could direct our companies in our network to investors and how we could better engage more investors to play a more effective role in the space. We are a network of entrepreneurs. We don't financially support that we are not today ourselves investors, but we do really want to better understand how we can pull the investor community together with us. Any questions or feedback or reactions to this? Because it's still very first screen. I'd love thoughts.
I have one.
Yeah?
I have a slide on foundation.
Yeah.
I'm aware of a number of services that went into that rural or urban almost urban space on top of basis.
Yeah.
For ground funding in the early stages to reach critical mass. Everybody working on this kind of level model.
Yeah, I mean, I think this is quite, maybe this is my take, and I'm sure others in the room have other opinions. My take is that because it's still very hard for many for-profits to get grant funding, because many foundations still have a forced binary that they only grant fund nonprofits as opposed to for-profits, that there isn't enough money playing exactly that role, and it's a really important role. That said, there are increasingly foundations that do that more effectively. I just think we need more of them. But I totally agree.
In fact, in India we have regulatory concerns where grants cannot fund the for-profit sector.
Yeah.
So we don't find grants funding the for-profit. Therefore, generally better. And from that perspective also, this slide is pretty important in terms of what can and how can one have a dual entity structure or have a hybrid structure where one could look at debt equity as well as grant, which will be quite useful in the initial year as we also for the healthcare.
Yeah. Just to, and for those of you who can't hear, I think you were saying that it's hard for for-profits to get grants, and I think you wanted to respond to that.
Yeah, there is a way around. I've been funding healthcare innovators with grants for many years. We structure it as a service agreement. So we give them a service contract, and then they do some milestones such as first prototype, custom validation, things like that. So it is possible to structure it. It's a little unusual, and you have to pay a little service tax as a result, but it does happen.
I'd like to add to that. We were exactly in a similar position.
Do you want to take this?
I'm sorry.
Specific program.
Yeah, so we were in a similar position like yours. So we got a grant from the Grant Channels Canada, we are a for-profit. So the problem is not with the local grants, but the foreign funding coming in, whether it qualifies in the FCRA or FIMA. And we actually ended up paying
So you have
income
to
tax.
route it through someone like this. I'm a non-profit in FCRA approval, and I then give that as a service contract
Right.
to you
Yes.
Okay.
as the for-profit.
Yeah, but then
apply with
the-
FCRA, and then you get a service contract.
Can you repeat
Exactly.
what you said for the others?
Yeah, so we are a for-profit social enterprise, and we got a international grant, but then we had issues with FCRA. As a for-profit, we could not qualify under FCRA. The lag phase, for getting approval could be anywhere between 6 months to a year, and it could also be possible that it may be rejected. So we had to actually accept it as you said, as a service agreement, in which case it may qualify under FEMA, and we would have to pay a tax on it, income tax on it. And one of the challenges that we faced, particularly that we got the grant money on like the 1st of February. And the financial year ending closing was on the 31st of March. So you were left with just 2 months to actually utilize those funds or pay a fee. So these are some of the challenges that
Funds are for capital or your revenue?
So this was for the project which was applied under the challenge. And so one solution definitely that we considered was routing the grant through a registered FCRA organization. But then the problem with that is getting the donor to comply with it. So after we've submitted all the grant application and given our banking details, to tell them that okay, we're going to route it through another organization, that will lead to suspicion. So these were some issues that we dealt with. There was a lot of trouble. I believe when Sandeep is here, it's first I think I think dealing. So this is one real problem. Another thing that we would be interested in knowing about the FDI norms in foreign direct investment norms for healthcare in India. Is it permissible for foreign organizations to fund us or?
Yeah.
Yeah. So, in fact, if it is capital which comes in, it's easier to do. Yes. If this grant would have been for revenue, then it's all the more difficult. As he mentioned, then really it doesn't take color of grant at all. It takes color of service charges, becomes taxable, both under the indirect tax and direct tax laws. As capital, you could still receive it. On the second question on FDI, 100% under automatic route, so there is no bar on healthcare investments from outside.
So bar?
No bar.
No bar. No bar.
So, in a nutshell, on that piece of the conversation, I think it remains very challenging for social entrepreneurs to figure out, especially if you're operating in for-profit entities, to figure out how to balance different types of capital. And you all are trailblazers, and I think that's part of the challenge that you signed up for in pursuing this duality of your mission. And I applaud you, and I just would comfort you by saying that almost every entrepreneur in our program is wrestling with this exact same thing. Maybe this is something that the Thai chapter here can try to be more supportive of, because the specifics in India are very complicated, and I don't know them as well as anybody in this room, but I do know that talking to a lot of investors outside of India, that the concerns about the extensive paperwork and restrictions around foreign direct investment do sometimes make, especially early stage investors, wary of the effort it takes to put a small amount of money in. Any other questions or comments before I hand the floor over to Acumen? Well, thank you for listening. Thank you again to Thai and KPMG for having us. And if there's any other questions after this, we'll be here and really happy to help. And again, I just offer that USAID is here, and if you have questions about some of their funding vehicles, they're also happy to chat.
So we have Jumar from Acumen over here, who will be briefly talking about a report that they have created. Over to you, Jumar.
Hi everyone, I'm Jumar. I work in the health space in Acumen. To your point, it's really easy to invest in healthcare. There's no bar, and we have been doing equity investments in health space since 2008. LifeSpring, which, as Sarah mentioned, is one of the members of your PhD Innovators community, is one of our investee companies. We believe in investing in companies which focus on the bottom of the pyramid, and we believe in investing in them what we call as the patient capital. What we mean by that is, when we invest in a company, we stay invested for about more than 7 years at any given stretch of time, because we think these are the kind of companies which need more support from their investors. And we have seen this model work for LifeSpring, and we have seen this model work for the company which I'm going to talk about today, which is Zikiza. Zikiza is a chain of ambulances, and it has operations in Mumbai, Punjab, Odisha, and Bihar. We conducted a study with them in conjunction with Grameen Foundation, where we wanted to understand the poverty outreach levels of the customers of Zikiza. So what Zikiza essentially does is, it is a PPP model with the state governments in these states, and the government is the enabler and the payer for the ambulance services, while Zikiza is the provider of the service. So we conducted the study using the Progress Out of Poverty Index, where what we wanted to assess was, through a set of 10 questions, understand the poverty levels of the customers, the callers of Zikiza. And what we found was that Zikiza's outreach in Punjab and Odisha, these were the two states where we conducted the study, the outreach is higher than the national average. So we had divided the region by Punjab rural, Punjab urban, Odisha rural, Odisha urban, and we figured that Zigiza's outreach was 76%. Of their callers were from below poverty line, which was tremendous, which was very insightful for the promoters themselves, because they understood before this that they were in the business of providing services to the poor, but they themselves didn't have any metric that they could call very confidently and say that yes, this is the concentration of poor that we are reaching. We had used this PPI index for the study as a part of our Lean Data initiative, which essentially is a system, which essentially is a new framework which has developed, which is useful for entrepreneurs a lot, because typically this is a very common concern that we hear across entrepreneurs in this space, is that they are in the business of servicing the poor, but they don't understand what is the level, what is the outreach that they have, what's the concentration of people under a certain poverty line that they are reaching. So this is a very simple questionnaire. The study was administered using phone calls, which were part of the feedback which Zigiza anyhow employed for its customers after providing the services. So it was very easy to administer the study, and it was very cost effective to administer the study. And as an investor, we finally have a number that we can call that yes, Zigiza's outreach to poverty is at a certain percentage, and it just works for us. It helps put things in perspective, and we are able to have more structured conversations. So I have few copies of the study here with me, and this is the study that we have, which we are releasing. And if you have any questions about the study, or if you would like to know more about the methodology and other findings, then feel free to ask me any questions. I'm here, available. And if there's other copies as well, if you would like to have a copy right now, you could just pick some. All right, that was it. Thank you.
We have Sandeep from Swasth, or any other team member from Swasth. If you would just briefly introduce yourself as well as what exactly we're looking at.
Good morning, everyone. I am Sandeep Kapila from Swasth India. I represent Swasth India. Swasth India is a 6-year-old social enterprise founded by me and Ankur. Both of us are graduates from IIT Bombay, computer science engineers. Nothing to do with healthcare per se. We spent 7 years of our life as management consultants. Ankur was in fact in this building in KPMG. I was at McKinsey. So 6 years ago, we sort of left that to start Swasth India with the goal of improving health of low-income households. We've gone through a journey in the last 6 years where first years were more like an integrator. We played the role of an integrator, trying to create micro health insurance, health management systems in rural and urban India in those days. That was more of a learning. Right now, what we do, which is based on our learnings in the first years, is we basically operate a network of primary care clinics in the slums of Bombay. We currently have 14 clinics with the 15th one opening next week. This is spread right from Bandra to Dahisar and Dharavi to Bhandup along the basically suburbs. The basic model is each clinic provides 5 Ds, we call them, 5 services with the 5 Ds: doctor, drugs, diagnostics, daycare and dental. So all of these services are available to people at half the market rates. When I say market, it's compared to the private provider probably next door or nearby. And the center breaks even operationally in about anywhere between 6 to 18 months. The range is wide because of the nature of healthcare. Even in spite of sort of the great value prop that is there, people do take time to build trust, and that sort of varies based on multiple local factors. That's essentially the model that we operate right now. The center model has been on for 3 years. It's gone through many iterations in coming up with this sort of what we call as a formula where it is self-sustainable, and at the same time it offers the social impact of a 50% reduction in out-of-pocket expenses.
which is basically originally our goal. In terms of funding, since we are discussing funding sources, etc., first 3 years we were self-funded. After that, once we started the model of being more B2C, working with consumers, setting up infrastructure, setting up clinics, we raised some capital, mostly through friends. And recently, we had Mr. Ratan Tata invest some capital in his personal capacity in this to help us scale this model from 5 to now the 15 centers that we have and growing. The challenges primarily has been in terms of finding the balance between social impact and commercial investments. We are a for-profit entity, and that makes it a little bit more trickier. Put it that way, very simple for anyone who's coming in, because grants do become slightly difficult, although there are ways we have received grants as simple gifts, no service tax. It's a gift from somebody, right? So could be with an agreement in terms of deliverables, etc. But it's gift, so it goes as gift income. If you're a profit-making entity, you have to pay income tax, but we are still not a profit-making entity, so we don't have the problem of the income tax there. We have had people who have sponsored centers, saying one center individually as institutions, etc., which says, okay, I'll just sponsor one center in the memory of somebody. Recently we had from IIT Bombay, Professor Kamath, a very renowned person from, he was the first HOD of the chemical engineering department. So some of the students said, we'll sponsor a center in his memory. So they've given us, it's about 10 lakhs it takes to sponsor a center. So that is sort of taking care of one center, and it takes it till break even. So that happens, that's as simple as I said, a gift income. There have been institutions who have funded some centers, they're in return, they're expecting some learnings. And we are very sort of open source in our philosophy and methodology in terms of sharing those learnings. So that has worked as well. And of course, there are people like Mr. Ratan Tata and our friends initially who supported us. There it's a very simple arrangement in terms of a preferential share, something. So I think we are trying to figure out this model, because pure equity, the challenges are in terms of the exit model, in terms of the pure orientation, in terms of how you look at this whole ecosystem, how you look at this whole model. We have had impact investors who come and tell us, if you are referring a patient, so what we do when we refer a patient, which everyone knows, right, there is a commission attached to it. The primary care physician gets a 30 to 40% plain commission, card, CUT, whatever term you call it, under the table. They get that 30 to 40% from the hospital, and this is from very big hospitals. We have had offers from very big hospitals. So the impact investor who comes and says, the first thing he says, what we do, sorry, on that front is, we basically say, don't give us the commission, give that as a discount to the patient. Right? So you are neutral on your revenue side, the 30 to 40%, let that be an out-of-pocket deduction for the person who is finding it difficult to afford that treatment at that stage. So that's the general way we tie up with our referral network. So the impact investor who comes to us says that, why are you leaving this revenue on the table? Right? So why don't you take that revenue in somehow? And that's the kind of sort of gray areas or ethical debates you start getting into when you are looking at it from a pure for-profit standpoint. Right? So those are the kinds of challenges we face as we think of raising capital to scale this further. We'll see. It's an evolving space even in terms of how funding is happening. Thanks. Any questions?
Do you manage the health records of all these patients?
Oh yeah, so one of the things we do, there is electronic, that's the computer science guys in us speaking, but basically from day one, everyone gets a unique ID. They get a card, we ask them to store it on the phone, it's just a number, nothing fancy about the card. Every patient who walks in, the electronic medical record is there. If you go to our website, you will see the live data streaming from there in terms of number of patients, number of registrations. One of the key two metrics that we track, which is again live on our database, is the savings to patients. So on every transaction, we know the market rate, we know the MRP, we know what's the market rate for this test, for this procedure. So we can compute every transaction level what's the saving that a person has got. So 50% is our goal, and sort of that number is reflected now. Same is with the customer satisfaction part, which you mentioned. Interestingly, this is the thing that most other organizations also want. Now we are working with other NGOs who are working in healthcare, rural Rajasthan, rural Assam, who are basically saying why we want to focus on the healthcare, not on medical records. So they are using our system. as a backend for their medical records. So that is a service in fact we provide now to others.
What would be a major area of expenses? Kind of, is it pharmacy, doctor's consultation fees, or maybe diagnostics, testing?
For the consumer or for us?
For a center.
For a center, okay. So for a, but just to put in, for a consumer today, when he spends 100 rupees out of pocket in outpatient, about 70, that is 70% of that is on drugs. That's the basic expenditure on it. But from a provider's perspective, the biggest costs are the rent and the doctor's salary or the salary. Drugs are actually from a cost standpoint very, very low. It would be about, let's say, even at our half the market rates, our gross margins are about 60-70%. And that's the reality of drugs in terms of when we as consumers pay 100 rupees as MRP, the cost of manufacturing, logistics, actual cost, leave aside all the supply chain, sort of again cuts, commissions, etc. in the system, is only 20 to 30 rupees on an average. In some drugs, it's as low as 10, the cost of manufacturing and delivery. You can call the rest as R&D, but that's essentially the way things are. And what we have been able to do is work directly with manufacturers to reduce that purchase cost and pass that benefit essentially to the consumer.
Government has now brought lot of standard price. Lot of price. 48 for and by March 2015, most of the price will come under price.
So the price control depends on the formula of price control. Yes.
In fact, Rajasthan is doing generic in Rajasthan. Materials of Rajasthan, they've adopted a very different model. They've stopped prescribing and selling branded drugs. So they say only generic, which has brought down the cost for almost like 20-30% in the range of 20%.
So in price control, just to answer your question, there was an earlier where 70 drugs were under price control. The formula was cost plus. Now the formula is an average of the MRP. The MRPs itself are so floating, so high right now. They are 5 times the cost, and an average of that is still 4 times the cost. It's not that.
Two questions actually, because I know what you are doing is very interesting, and Ankur has been an ex-colleague. One is with respect to your clinic network, and if I take population health that you're trying to cover, what's the kind of population cover that you see one of your clinics taking care of? The second is, I'm sure you're aware, but the Universal Health paper actually talked about a certain amount, close to $100, which they said that look, we are going to allocate a certain amount for primary care kind of coverage. Wanted to get a sense that what's the cost according to you if you had to run it in a sustainable manner on an ongoing time for a year? What?
So, first question, a center's catchment is about 100,000 lives. And in Bombay slums, you of course know that's very feasible. Getting a center in half a kilometer zone. In primary care, the tricky thing is that people don't want to travel, particularly if there is a choice in a place like Bombay. They won't go more than half a kilometer or 5 to 10 minutes walking for primary care because there is some doctor everywhere available. In terms of costs, typically our center takes it's 6 lakhs for setup one time. To set up the center, this includes the deposit for the place, etc. It's on rental. And it takes about another 6 lakhs odd in terms of expenses till it breaks even. So after that, it's sort of on its own in terms of the payments from the people who will recover the running costs of the center. So that's the sort of 12 lakhs roughly that's what it is.
So Sandeep, my question was, if the government allocates 6,000 rupees a person for his care, like what NHS does of 125 pounds on the list, do you think that is sufficient for your network to run? Because I think it's a great model you have.
6,000 for primary care is quite sufficient. In fact, I think that will allow us to do a lot more of preventive work, which we are not able to do in this model. So preventive work is something where we've created some sort of business model, but it's not fully sustainable. Like just conducting detection camps for hypertension and diabetes. Right? People are willing to pay 10 rupees for a BP checkup, 20 rupees for a sugar checkup, but that doesn't recover all the costs. It will recover your consumables, it doesn't recover all the costs. But this kind of 6,000 rupees will allow for that. 6,000 per person is quite significant.
Per year.
How do you manage diagnostics yourself?
So, So very simply, both diagnostics and lab, we have our own centralized pattern. Pathology, definitely not radiology. Radiology we refer. So samples are collected at our center, they come centrally to our lab, just like everyone else does right now. They are processed there through our EHR, the reports go, so reports don't physically travel. Same with our manufacturing. For radiology, we refer again with our discount system. So instead of the commission, we say give the discount. Advanced pathology, we again send outside.
So we monitor this discount within
The people? So it's a digitized, everything is digitized, patients are aware what the rate is. It's a very transparent system to the consumer. That you have to basically use the consumer for it. So he knows what's the expected rate is, what he's going to pay. And the MRP is there, so we know again, so we track it at every transaction level it's tracked. And yeah, everyone is welcome to visit one of our centers. The nearest will be in Dharavi, is there in Bandra East, Dharavi 90 feet road will be the nearest one.
I think what we're going to do now is we want to just go around and do quick, I know there's a lot of people in the room, quick introductions, and then we're going to have about half an hour for networking, so please feel free to find Sandeep and ask some more questions about his business model. And I think we have a great room here of healthcare entrepreneurs, people from the healthcare investment community and others that are interested, and so if we can have everyone very briefly go around and say their name and the organization that they work for, then that'll enable some better networking, and then afterwards we have coffee and snacks over there. So if you want to just start.
My name is Arun Das, as Vijay said in the introduction. I've been in the healthcare for about 8 years. I run a franchise in the clinic. I did start up a chain of small independent hospitals in small towns outside Mumbai. We could not continue an operation because we could not sustain it. It closed down earlier this year. But of course, I'm still involved in healthcare, driven by mentor a lot of young entrepreneurs, including people with technologists versus doctors, technologists versus patients, people of services and so on. So I do enjoy mentoring.
Good morning everyone, my name is Rohika. I started out last year, and what we do is, name of my company is Avners. We help overseas companies, healthcare companies, enter the Indian market. So currently we are focusing on medical devices, and the social aspect that we would target is bringing affordable medical devices to India. So for example, there might be a company in China or Korea. They can provide a better price diagnostic kits, but since we do not know, we cannot, and since they have perception about India, they might not look at India, they might look at sending the products to US. So what we do is streamline this, and we would like to bring in those companies to India, set up base, and distribute their products in India. So,
probably it's that just hold the mic very close to your when you're speaking, otherwise it's not really audible, right? Okay. Thank you.
What I would like to do is over here, since we will also be running short of time if everybody came in on the stage. How many of you from are entrepreneurs in the healthcare sector? If you could, wow, that's wonderful, wonderful. So what I would like to do is quickly, I'll get the mic to y'all and just the entrepreneurs first. So take it in the sections, the entrepreneurs, the investments, and the institutions over here.
Thank you. This is Dr. Vinay Goyal, and I have a company called Lifecare Diagnostic and Research Center. We have the delivery system. We have multi-diagnostics spread all across Mumbai and Pune. We have peripheral referral chain of collection centers and pathology laboratories, which help both the rural as well as low income and high income groups. And we've been there for 19 years.
Thank you. Next over here on this slide. Okay, we just say.
Hello everyone, I'm Komal Kadaba.
Close to the.
Hello everyone, I'm Komal Kadaba. I'm a first generation entrepreneur. I'm a student at Wellington Institute of Management. We're working into the renewable spaces and trying to provide reach into the accessible rural areas which need access right now for medical services.
Hi, I am Dr. Hemant Vadia. I am a surgeon by profession. I have been practicing surgery for 25 years. Now I have turned into an entrepreneur. And we formed a company called Aruj Healthcare Innovations. And we are entering into the home healthcare market.
Excellent. Hello everyone, my name is Rentu Patnaik. I am co-founder of a company called Dominator DigiHealth. I have basically what's the process of technology management experience in biotech health insurance. So we are an early stage startup, 6 months now, and primarily focused on mobile health applications and data. Wonderful. Sorry.
Hi, I am Dr. Sangeeta Dasgupta. I'm one of the co-founders of Arogya Online Healthcare and Information Services. We are also an early startup company getting into digital health space. And yes, one more key area which is core to us is home healthcare space, which is also what we are exploring in the near future.
Thank you.
Hi, I am Dr. Vishal Marwa. I am the founder of Vishwas. Vishwas is a social enterprise, and the goal of our organization is to promote family medicine and primary care in India through physician leadership. So we train young MBBS doctors in skills that they don't usually learn in medical school, like behavioral medicine and psychology, how to be more empathetic. And we're trying to promote a concept of physician leadership. And we also have an innovation lab where we bring together doctors and designers to work together and collaborate and come up with innovative solutions to small healthcare challenges.
Hi everyone, I'm Amin Samboi. I'm co-founder of a company, Radioread Solutions. My partner is Dr. Manish. So we provide teleradiology solutions, mainly CT, MRI and digital X-ray recording. We are working in 2 tier, 3 tier cities. Also we are concentrating on rural areas.
Thank you.
Hello everyone, I am Dr. Sabir Tapyawala. I am a homeopath by profession since 1996. And recently I have found the company called as MediIT Health Solutions. We are into electronic health record. And we have already developed this particular electronic health record system, which is completely integrated and highly automated. And our objective is just to provide a platform where all the players of the healthcare ecosystem can come and talk to each other and share their data. That's what the main objective is. We have both in web as well as mobile applications. We entered the market in January this year, and till date we are operating in the very limited locality of Mumbai, and we have registered around 750 doctors by this time. And these doctors have registered close to 25,000 patients. We have already covered more than 175 chemists also, and you can say around 30 diagnostic centers. So we just want to collaborate, make the network of various patients, whatever is happening at the ground level, we just want to take it virtual so that it can help each and everyone, and health records are available anywhere, anytime. That's the main objective.
I represent MyCare Health Solutions. My name is Shishir Gandhi. MyCare is into a chain of primary care clinics providing solutions like consultations, medicines, diagnostics, and other services. The difference from others is that we don't work on a fee-for-service model, but we work on an annual membership model, where once signed up, all these services are provided free, unrestricted, and unlimited.
Hi, my name is Natwar Chandak. By profession, I am chartered accountant. But I recently started a startup in healthcare and telemedicine. So our concept is to tie up with larger hospitals in catchment areas, say Mumbai, Pune, and Hyderabad, and open telemedicine centers in district and sub-district places, and provide e-consultation from there. So e-consultation, e-treatment consultation, e-treatment cost comparison, and those services to the patient. So they don't need to travel for every say opinion and every small consultations. And then we also our plan is to provide them further services like what we do with a medical tourism, but this is like a domestic medical tourism going forward. So we are opening our first centers in Akola, say in 2 weeks.
Hi, my name is Sanket Rajadhiksha. I'm from the technology background, and I recently started up working on a cloud-based pathology solution, just focusing on the pathology market right now and trying to move them from a box software kind of a mentality to going into the cloud, sharing the data.
Hi, I'm Harsh Sami. I'm a founder of a startup called Extrudified Technologies, and we are trying to get into the 3D printing application for the healthcare space, basically focusing on surgeons and also dentists who are trying to apply these services that they can use for their benefits and for the patients as well.
Hi, I'm Mahesh Kale. I'm basically from Technology Background, and we just started. Audible? Yeah. I'm Mahesh Kale, and basically from Technology Background, and we just about started mostly on the devices and on the developing side of the end. Anybody have a question?
Hi, my name is Prasad. I'm the founder of a company called IG Care Home Services. We are into home health care, but specifically focused on non-medical and companionship.
Hello everybody, this is Tejas Mehta, co-founder of Synergy Medical Systems LLP. We are basically providers of diagnostic instruments and reagent kits to diagnostic centers and GE labs across India.
Anybody over here as entrepreneurs into the healthcare? Okay, the investors. Okay, one more, yeah.
I'm Dr. Monati. My husband works in public health examination and information.
Thank you. Okay, gentlemen over here.
Hello, I'm Rajesh Pandikar. I was head of distribution for Pfizer and in India, Bangladesh, Nepal and Sri Lanka market. I am interested in investing in companies who would like to reach medicines to rural parts of the country. I can help with the knowledge and the know-how.
Wonderful. So we have the entrepreneur on one side, we have the investors one side. We come. Yeah, go ahead.
Hi, this is Bipin Thakur. I'm with Apply Materials.
Yeah, absolutely.
I'm with Apply Materials. We are investors with a difference in the sense we are actually a technology company. But we have Applied Ventures, daughter company, which we use to invest in the startups. And considering that technology is only paramount in this sector, we are currently looking at not just enabling the technology, but also maybe investing in something.
Wonderful.
Yeah, just a bit.
Yeah.
No. I'm not as yet an entrepreneur, but in another 3 months I should be working on a healthcare project which we plan to start by December. I'm actually out of Johnson & Johnson. I used to run the pharmaceutical company, and my basic experience is in medical devices as well as pharmaceuticals.
So actually I missed one category, which is the aspiring entrepreneurs. So yeah, we have investors, aspiring entrepreneurs, investors, please.
I'm P.R. Ganapathy with Pilco, a early stage incubator with social enterprises. Specifically, we fund a lot of tech at the idea and pre-prototype stage.
I'm a senior business analyst with Cognizant Technology Solutions. Aspiring entrepreneur, I recently had my white paper published on the Cognizant website, which is turning the vision of connected health into a life.
Investors.
Hi everyone, most of you have already heard me speak. I'm Jhumar from Acumen. We believe in investing in companies which have products or services catering especially to the poor, be it in urban areas or rural areas. So any companies which are interested, which have their business model aligned to this mission, I would love to connect with you.
Hi everyone, my name is Karan and I work with an organization called Tasra based in Mumbai. We raise funding for non-profits from both individual philanthropists as well as corporates, and we provide non-profits with both access to capital as well as capacity building services.
Hi, I'm Rajat from LGT Network Philanthropy. I just heard the word talking about agreement and pretty much replace agreement by LGT and over that. They're in India since 2009 and so far exposure in healthcare has been Operation Asha. This is a non-profit resort area. But we find a lot of opportunity in this sector and I'm pretty excited to be participating.
Thank you. You one.
Science Ben, Deutsche Bank's Global Service Finance Group. So we're out of the US, and we're able to fund companies with debt or loans. Typically companies that already have about 240 million rupees in revenues already and are either breaking even or quite close to it.
You can fund all of us.
So hi, I'm Sohen, and I represent Intellicap Impact Investment Network. We are an angel network focusing on investing in healthcare companies, early stage for-profit healthcare companies, which cater to the bottom of the pyramid, tier 2, tier 3 cities and rural areas. So I'd love to meet all the healthcare entrepreneurs here later.
Excellent, excellent. Did I miss any of the investors? Very important people, right out there. Okay, so we had the aspiring entrepreneurs, we have the entrepreneurs, we have the investors, we have somebody from the institution as well, right? We have Wellington students out here as well, right? And you, Mr. Gentleman.
Zikitsa, my name is Nanda. I believe everyone has covered what we do. There are parts like on B2B model as well as we do multi-minded ambulance services, which is on-call basis. We spread across all India. Not take much time, but we can cover everywhere.
Thank you.
Hello, it's a bit different. My name is Himal Mehta, and I'm a consultant to an IIT Mumbai company, which is anytime, anywhere access remote monitoring technology. So basically, probably I think
Hello, my name is Maggie Lennox. I'm with the United States Agency on International Development, USAID, and we are part of a program that works to combine science, technology, and developing health knowledge. So we are always very interested in the health field. We have many different programs, different ways of funding, supporting, and sharing the information and the products that you make and do with the rest of the world. So please find me if you'd like to talk more.
So we missed one group, which is the professionals or the consultants. Anybody over here, professionals, consultants? Oh wow, got it.
My name is Dr. Pandit. I am an entrepreneur, but my entrepreneurial activity is not related to healthcare. I've been a farmer. I've been into, let's say, medical transcription at one stage. And at the moment, I'm completely away from the medical field. But based on that experience, I'm open to share views and opinions. So urban, rural, lower income group, quite a few things, a lot of active experience in all these things. Thank you.
Hi, this is Harshal. I run a service, MindMeG, and we help enterprises, not-for-profits with their accounting and compliance needs. So we are working with quite a lot of non-profits as well, and helping them route their money with all compliance and PS as well.
Excellent.
Hello, my name is Gaurav, and we are developing NGP. So basically, we help all the startups in fundraising, execution level, and scaling up the level to the next.
Yeah, sure.
I'm Jamini, Senior Advisor in Healthcare Practice with KPMG, but I also run an NGO called Foundation for Environment Conservation. I'm a farmer and organic farming. We also do training programs for rural hospitals in and around Maharashtra.
Excellent. Anyone I may have missed? Okay.
Morning, I'm Ajay Jain. Presenting masterclass who has helped more than 1,000 true entrepreneurs to take their company to next level in a simplified way. Plus, I'm also associated with social organization called Mahavir International and JEET. Thank you.
Yes.
Sandeep Bhalla from KPMG. I focus on the healthcare sector from a tax related perspective. So I came in at the right time.
Good morning once again, and this is for me personally. Dr. Ragini again, clinician, business person, and now a mentor with Wellington Institute of Management and Healthcare Management
my name is Kaustav Ganguly. I'm a director with the management consulting practice here in KPMG, and I lead the strategy services for the healthcare vertical in KPMG India. So naturally, apart from working for a lot of large organizations on their business strategy, we have had the experience of working with new entrepreneurial setups and advising them on their entry and scale up as well.
Sure.
Hi, I'm Dr. Santosh Shah. I've been an entrepreneur for the last 3 years, and I'm currently into the overseas education, coaching and consultancy part of it, but looking for opportunities in the healthcare space.
Okay. So, anybody else? I missed on giving an opportunity to introduce. Anybody would like to introduce? Okay, great. So, what we noticed over here, we are around 60 to 70 of us right over here, and the power of what we are doing today over here. There were aspiring entrepreneurs, there are aspiring entrepreneurs, there are entrepreneurs, there are professionals who want to serve the community, there are investors who want to invest into the organization. So what is happening is we are building a community right over here with just 60, 70. Imagine now if we have to take it at a level where we see almost more than 500, more than 1,000, more than 2,500, 2,000, and that is what the power of TiE is today. And just while we were just discussing all this, the name that we want to give, and I just quickly shared it with Amit also, if we can announce that. So what we want to call this community, and I want everybody to participate and be part of this group, which we want to name it. This is a proposal. Again, we may change it, but what we want to name it is TiE's Hen. So T-Hen. So basically, TiE's Healthcare Entrepreneurial Network is what we want to call it. And this community is what the entire vision of Arun and Amit together is, how this community can benefit. Individually, when we are not connected, there are many challenges that we know and we do not know where the solution is. And this community that we are looking at building will help in getting a solution for each and every person. Having said that, what I would like to do is call Anne over here from IPHD. Thank you so much, Anne. It's been a pleasure to have you here. I'd like to call Amit also from KPMG. Thank you so much for the support from KPMG. And Sarah, if you could just quickly introduce the team that is there. I know there's
Great. Just to wrap it up, I'm Anne Catherine Wales, and I work at IPHD along with Sarah, and then Logan Kosei is back there. And so we would love, as we bring out into the networking session, if any of you all are more interested in either joining our program, learning more about our network, or learning more about any of the research that Sarah shared, we would be happy to have those conversations. But really excited, as I mentioned, to see so many healthcare entrepreneurs in this room. I'd love to see how we can support you.
Thank you. So we'll just break over here for some breakfast out kept over there and the networking. So now we know each other very well. Let's go ahead and